Hey guys, we're going to go over interprofessional collaboration with a registered dietitian. My name is Jaden.
My name's Bailey.
And I'm Haley.
So we had case study A with Glenn Olds. We're going to kind of go over a little bit about him.
So he went into the doctor for needing a transplant, and the doctor said that he wasn't stable enough for that, so he came into the dentist, and with what we found in his mouth and with his history and stuff, this is the treatment alt, the diagnosis, and just the treatment plan we had for him.
Okay, and we interviewed Keely. I don't know how to say her last name, but she's a registered dietitian that works in Las Vegas. And you'll see as we kind of go through her answers how much she already kind of knew about hygiene and working with them. We were kind of shocked by that, and she's been a dietitian for 15 years. The first question we asked her was, how important do you feel interprofessional collaboration is for your patients and why? She said, interprofessional collaboration is very important for my patients because nutrition, oral health, and overall health are connected. Working with dental professionals, physicians, and mental health providers helps ensure patients receive well-rounded and effective care. And then question 2, is your patient's mental, social, and physical health affected by their oral health, and kind of her thoughts on that. And she said, yes, oral health significantly affects physical, mental, and social health. Oral pain or infection can limit food choices, affect nutrition, lower self-esteem, and reduce quality of life, which can impact both physical and emotional well-being.
Okay, question 3, how often do you ask about your patient's oral health? And she said, I ask about oral health fairly often, especially when patients report difficulty chewing, swallowing, or following nutrition recommendations. Oral health issues can be a major barrier to meeting nutritional needs. I always try to refer them to the appropriate healthcare professional when needed. Question 4 was, what would you do if your patient brought up concerns about their oral health? She responded with, if a patient asked about their oral health or had concerns, I would listen, provide general nutrition-related guidance, and refer them to the dental professional for a full evaluation since collaboration leads to the best patient outcomes.
So we introduced the case study but didn't give her any of the patient's dental history. And so we asked her with this information what she would do or what would be the main goal for this patient. She said that her main goal would be to keep him nutritionally stable while managing his fluids, sodium, and phosphate restrictions so that he stays healthy enough for transplant eligibility. She said she'd focus on adequate protein intake, blood pressure control, and supporting his overall energy and mental health. We then asked her, would you work with any other healthcare professionals to help this patient meet their treatment goals? And she said, yes, absolutely. I would regularly collaborate with his nephrologist, dialysis team, primary care provider, and mental health provider to make sure nutrition, medications, and emotional support are aligned. This kind of coordination is essential for complex dialysis patients. The last question we asked her before we introduced his dental history was, do you feel like working with a dental professional could help your patient meet their treatment goal? And she said, yes, I do. Patients preparing for transplant need to minimize infection and inflammation risk, and oral health plays a role in overall systemic health. Working with dental professionals helps support transplant readiness and long-term health outcomes.
And then we introduced the dental history to her, so we kind of went over that he was wanting a transplant, and they said he couldn't have one, and that his last dental hygiene appointment was 5 years ago, and he started using tartar control without fluoride because he is afraid of ingesting fluoride.
Okay, so after introducing dental history, some of the questions were, knowing this information, does it change any of your answers from before? She responded with, yes, knowing the patient has periodontitis highlights that their oral health could be contributing to systemic inflammation, which may affect their nutrition status, blood sugar control, or cardiovascular health. I would now consider dietary strategies to help reduce inflammation and support oral and overall health. We asked, if this was your patient, what would you want their dental provider to be aware of before their appointments? And she said, I would want the dental provider to know the patient's medical conditions, any medications that they're taking, and any dietary factors that could impact healing or inflammation, such as high sugar intake or low intake of anti-inflammatory nutrients. And lastly, what would you want the dental provider to do or focus on during this patient's treatment? And she responded with, I would want the hygienist and dentist to focus on reducing bacteria, controlling inflammation, preventing further tissue loss, and coordinating care with me to ensure the patient's diet supports healing and overall health.
And then our final question to her was, what other concerns or comments does she feel are pertinent to this case? And then what other things came up when we were interviewing her? And she said, asking about the patient's medications, medical history, and lifestyle factors that could impact oral health and healing, she thought would be pertinent. And then while we were interviewing her, she emphasized the importance of coordinating care between medical providers like her and us, and considering systemic inflammation in the patient's overall treatment plan.
So just kind of in conclusion, interprofessional collaboration is beneficial to patients, especially when hygienists work alongside dietitians. Dental hygienists often identify oral signs related to poor nutrition, and dietitians can address the underlying dietary causes. By working together, they provide consistent education, reinforce preventative strategies, and support overall health.